Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. In today's video, we have my wife back for another treatment. She is in her second trimester. So Nicole, what is changed since your first trimester being pregnant?
Yes, a lot has actually changed since the first trimester. One of the good things is that I have some energy back, which is very helpful in keeping up with my 4-year-old and my 2-year-old boys. Some of the difficult changes that I've experienced is that along with the weight gain, I've been having some pain, tightness, discomfort around the tendons, muscles, and ligaments in my stomach area.
Have you had any more back pain since your first trimester?
Yes, a little bit of back pain, but more so I would say in the second trimester, I've had upper back pain. And pain, which has caused a couple headaches, which you have definitely helped treat.
How about indigestion? Have you had a lot of heartburn?
Yes, it is a constant and daily struggle with heartburn.
So one of the things we'll do sometimes with our pregnant patients is we'll also work on their mid-back here. Sometimes adjusting this area can actually help with the heartburn as well. So what we're going to do today is we're going to demonstrate an adjustment for a pregnant patient in her second trimester. And then we're also going to demonstrate taping technique to reduce the stress on the ligaments and the tendons in the front of the abdominal region. And we'll also show a pregnancy belt as well. So depending on the patient, sometimes we'll do more taping or sometimes we'll do more of the belt option. The nice thing with the belt is obviously you can take it on and off, and the tape will stay on for 4 to 5 days. But those are great options to help alleviate some of the pressure on the anterior abdominal wall there.
The tape and the belt have been very helpful. I have to constantly keep up with my boys. That includes running after them while they're on their bikes, still jogging at this point, and wrestling with them, carrying them up and down the stairs. And I'm also playing volleyball right now, so the taping and the belt have very much helped keep the weight where it's supposed to be and the pressure off of the muscles, tendons, and ligaments.
Okay, so let's demonstrate the adjustment part. Okay, so now we're going to demonstrate the adjusting portion. So again, with our table, we have a couple special pillows that we use for the abdominal area. So the baby's going to basically be in this cutout area here. And so we're going to have you lay on your stomach here, face down on the table. And that allows her to relax and allows me to work on the muscles in her low back and help take pressure off her mid back and also her low back here. So what we're going to do is we're going to work on the, we're going to check out the joints here in her low back. A lot of times in the second trimester, you know, basically your body is preparing for delivery, so your body is releasing more hormones and stuff is starting to shift a little bit more. You get a little bit more pressure in the front of the abdominal as the baby gets bigger, so that's going to put more stress and load on the low back and into the hips. So what we're going to do here is we're going to adjust her sacroiliac joints right here. And then we're going to work on some of the soft tissue component on the back side to help loosen that up. And then at the end, we're going to tape up the abdominal area to help take pressure off of her back. So for the first adjustment for the SI joint, we're going to use this table here. This is called the drop table, and basically it helps us just to add a little bit of more pressure onto the joint and help to get it to release. So we're going to do a couple adjustments on her SI joint. Good. And now we're also going to use an adjusting instrument to help adjust the joints and to help loosen up. So now we're going to use an adjusting instrument to safely adjust the joints. So we have multiple ways we can adjust the patient. It depends on the patient what we use. Sometimes we'll use a hands-on approach where we'll have the patient lay on her side. Sometimes we'll use the drop table, or sometimes we'll use a combination of the adjusting instrument and all the others. So in her case, we're going to adjust her joint right here. And this is going to help to take the pressure off these joints and get the joints moving better. And again, her muscles are very tight because she's starting to compensate and her muscles in the front are starting to weaken and the baby's getting bigger, so she's getting more stress placed on her low back here. This is totally safe for the baby and the mom. It actually feels very comfortable and gives her a lot of relief. The third type of an adjustment we're going to do, we're going to have the patient lay on her side. So I'm going to have you come up to a hands and knees position on the table. I'm going to pull this pillow out. Good. And we'll set this down. Okay, and let's have you lay on your side and face me this way. Okay, and just rest your head on the pillow there. Can I have you straighten this bottom leg and just bend this one here? This arm is going to get placed right on top here. Perfect. We're just going to bring it a little bit into flexion. I bring you my way, take a deep breath in, and blow it all the way out. Perfect. And again, this is totally safe for the baby and the mom. This is going to relieve a lot of her low back pain. And a lot of times people come in with a sciatica. That's a very common condition with this. It responds really well to this type of treatment. In the next part, we're going to tape up her abdominals. We're going to take pressure off her abdominals by placing the tape underneath the baby and underneath her ab area there. That's going to reduce the strain on the ligaments and help take the pressure off. Okay, now that we have the patient adjusted, now what we want to do is we want to put some tape on her abdominal area to reduce the strain on her ligaments and also on her low back. So in her case, she's been experiencing pain when she's been rolling over in bed, and so that's kind of straining the obliques a little bit here. So we're going to put 2 vertical pieces along her abdominal, and then we'll put one underneath the baby and then anchor it in your back, okay? So we're going to use a tape called Rocktape. This is a great brand of tape that we use. The reason we like this for pregnant patients is they have a sensitive version. A lot of times when pregnant patients get bigger, there's more stretch on the ab area there. The skin becomes very sensitive. And we use this brand because they have a sensitive tape version, which works well and doesn't itch the patient. So we're going to basically place this vertical one here. We're going to anchor it down low here. There we go. And then we're going to come up right along the side here. There we go. And the glue on this tape is heat activated. So basically we're going to rub and massage the tape. And that friction from our fingers is going to make it stick better. And it's going to help it last for, usually it lasts about 3 to 5 days, depending on the patient. And you can shower and exercise with it on. It'll still stay on. So we have the 2 vertical pieces. Now we're going to anchor this piece underneath, and we're going to anchor it in her mid-back here. So we're going to rip it down the center here. Turn and face me a little bit. There we go. Okay, and then let's have you turn this way here, and we're going to pull that tape up here. And this is going to end right in her kind of mid-back region, right where her lats are. And that's going to help just kind of anchor that whole area. Let's have you turn towards me and arm up for me there. And then we're going to go in this position and then again anchor right into that lat area there. Okay, turn this way, and then we're going to rub the tape to activate it, make it stick. Any area where there's tape that's overlapping, you want to rub a lot more in that area because it makes it stick better. When you have tape doubling up over that area, it will sometimes make it stick not as well. But this is a great application. It lasts about 3 to 5 days. A lot of patients prefer this technique versus wearing the belt. It's a little bit more comfortable. It kind of goes with your body. It's there, but it's not restrictive. So it's just going to support you. It's almost like another ligament or muscle there that's just going to take some tension off of that. So Nicole, you've worn both. Yes. So what would you say the difference is between, and which one do you like the best?
I actually prefer the Rocktape for several reasons. One is that I feel that the Rocktape actually moves with me, whether it be playing volleyball or playing with my kids or doing daily chores. It's also more comfortable, not as bulky. And one of the best benefits, and all moms will understand this, is that when you have to go to the bathroom, obviously you have to take off your belt. This, I do not have to take off my belt, and that's definitely an added bonus. Both definitely provide support, but overall I do prefer the Rocktape. Yeah,
and we show patients how to do this, how to apply this at home. We can obviously do this in the office, but it's actually easy enough where we can show them how to do that and their spouse can apply it to them. Because again, it'll last for about 3 to 5 days. So you do have to reapply it, but it's a very good option. Again, we like it because it doesn't irritate the skin and it just gives that enough support so it takes the pressure off that. And as you go further along in the pregnancy, you'll definitely have more and more pressure on that front ligament, and this can really help. So if you're pregnant and dealing with any back pain or any sciatica or any kind of ligament pain, give our office a call at 703-912-7822, or you can schedule online at novachirowellness.com.